7 reasons why you shouldn't be scared of scoliosis. Number 1, surgery isn't the only way to treat scoliosis. Those on the traditional path of scoliosis are commonly funneled towards spinal fusion and surgery as their curves become more severe, and very little is offered to them while the scoliosis is mild or moderate to try to prevent it from becoming severe, so therefore they're never recommended spinal fusion. The reality is many cases of scoliosis don't require surgery, especially if they're treated in the mild and moderate stage, because modern conservative treatment has a very high success rate at reducing a scoliosis and making curves actually improve before they become in the severe stage if the modern conservative treatment is integrated with many different type of treatment options. Number 2, severe deformity is extremely rare. Oftentimes, the postural effects of scoliosis can be very subtle. In fact, the majority of cases in adolescent, we believe, go undiagnosed because the postural deviation is so mild, it can't be diagnosed. And if the postural deviation were to become more severe, a person that's committed towards proactive chiropractic-centered treatment approaches, this postural deviation can typically be improved. And in many cases, even with severe scoliosis, patients' posture could be improved so significantly that it can be very difficult to even determine if the patient actually has scoliosis. Number 3, female with scoliosis can have normal pregnancies and labors. Scoliosis is a spinal condition, and it's the pelvis that's engaged in pregnancy. Now, scoliosis is not known to make it harder to become pregnant or to make pregnancies more complicated. In fact, the only thing associated with scoliosis in pregnancy could possibly be the epidural. When you actually have the epidural, the doctor providing the epidural has to know that you actually have scoliosis and what side your curvature goes to actually perform the epidural correctly. So that's the most complicated thing associated with scoliosis and pregnancy, is the fact that the epidural may not be done properly. Number 4, people with scoliosis don't always have to limit their exercise. Exercise and staying active is an important part of scoliosis treatment, and leading a spine-friendly lifestyle is also a very important aspect of scoliosis treatment. And we know being active and doing exercises are things that can help spinal mobility and overall health. Scoliosis-specific exercises are a very important facet of scoliosis treatment. They're used to help strengthen the spine in an asymmetrical manner, but you normally don't have to limit the exercises that you're performing. If you have scoliosis, there's no evidence to suggest that one exercise is worse for you than other. Patients that go through scoliosis treatment don't have to limit the exercises or sports that they're participating in, because there's no evidence that supports that one exercise, meaning sport or activity, is worse for a patient with scoliosis than not. In fact, many patients with scoliosis can achieve very, very high levels of competitive sports. I mean, look at Usain Bolt. He's become an Olympic gold medalist with a significant scoliosis in his lumbar spine. Number 5, corrective bracing doesn't have to be cumbersome. Now, traditional bracing that's typically associated with many, many shortfalls, something like a Boston brace. And these Boston braces tend to be more cumbersome because they extend lower down into the body and make it very difficult for a patient to be compliant because they affect the way a person sits. In addition, the compliance with the brace tends to worsen because as the curve worsens, the brace creates more and more pressure, creating less and less comfort associated with the brace. Now, corrective bracing, things like Scoli braces, uses state-of-the-art technology to make sure the brace is as light and as thin as possible, and it's designed to suit an individual patient's body curvature and body type, making the brace less bulky. But most importantly, as the brace is improving the scoliosis, the brace becomes more and more comfortable as time goes. Kind of like braces on your teeth. When you initially put braces on your teeth, the first week or so is difficult, but after a week, 2 weeks, 3 weeks, you don't even notice braces anymore because as the teeth change, there's less and less pressure associated because they're actually getting better. Number 6, scoliosis isn't caused by carrying heavy objects. Often when people are diagnosed, they're concerned with the role of the condition and what they did to cause it. Meaning, if they were doing something that created, like carrying too many heavy objects, carrying a backpack incorrectly, or sitting with bad posture. If bad posture or carrying backpacks incorrectly cause scoliosis, almost every kid will have it. Scoliosis is not caused by this. It's caused by some underlying structural condition that's idiopathic in nature, and it happens somewhere in their juvenile years. And unfortunately, it can can progress during adolescence. So we find the scoliosis progressing way beyond when it was initially caused. And very often we believe whatever caused the scoliosis may be irrelevant at the time of diagnosis, because the body may have already recovered from it. But now, since the body has developed a curve, when they grow, the curve worsens. So the curve worsens because of growth, not because of normally something the person did. Number 7, spinal collapse is highly unlikely. Many patients worry about their increased spinal degeneration, and the scoliosis progressing could lead to their spine collapsing. Now, even though that is possible, it's not likely. A complete breakdown of spinal integrity is not likely, especially those that are committed towards proactive treatment. In fact, patients that are committed towards proactive treatment, especially a conservative, modern conservative chiropractic-centered treatment approach that's going to work on reducing the scoliosis, the likelihood of the curve progressing to where the spine collapses is very, very, very little, because of the treatment that we're doing, how often we're monitoring it. Now, not treating a scoliosis and just not monitoring it will put you at higher risk, but even then, it's highly unlikely. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.